So this exercise is the standing hip rotations with foot loading. And this is personally one of my favorite exercises, and I use it with so many clients for a couple of reasons. Firstly, because we get a whole body movement, which is really important, and we're focusing on specific joint actions and mobilizing and moving the joints as we want to. And the second thing is because we've got a bit of variety with the movement, and we can start to, with the cues that we use, we can direct the focus on what we actually want to achieve as an outcome for the exercise. So we stand parallel to the wall, okay? And we just have the hands against the wall to support. We want to make sure that the foot is in line, or that the toes are facing the wall, and we need to build a tripod or a triangle. And specifically, we need the heel, the big toe joint or big toe knuckle, and the small toe knuckle or joint to stay on the floor the whole time. From here, we stabilize and we just lock the knee, rotate across the body, keeping the knee locked, so letting the hips rotate in the pelvis. And we want to make sure that that foot does not lift up. So we keep it there, rotate. Then when we go the other way, we open, we bend the knee forward and inwards, and then we repeat. So as we do this, as I bend that knee in, I'm allowing the foot to flatten into pronation. So I'm letting the hip rotate in, the knee bend into pronation and getting pronation for the foot. And then as we go the other way, I'm getting some nice hip internal rotation, but I'm also locking the knee and getting supination of the foot. So we can cue and direct the focus depending on each client or patient of whether we want to focus on getting more movement through the hips and start to get some more spinal and pelvic movement, or whether we want to really focus and dial in on the foot. And for that reason, we can get so much out of the exercise, and it's a really important full body movement.